Okay, part two of the video. So remember in the last video we were talking about having two people, pretty much the same person, same equity to the chance of survival with burns and everything. So do you treat those person even if they have a high chance of survival, but they're using a lot of your supplies, and or you decide not to treat, or you decide I'll just treat one of them, but then where's the try? So you're starting to see. And the reason I did those scenarios is that those are the kind of question, and you'll have to, and hopefully with those two videos that I'm doing, what you're going to have to start doing is I think you'll have to start sitting down with the people. So either that you're going to start doing some survival with the community, sit down and have serious discussion about, maybe even have a ethical board. So for example, I have three person that have different backgrounds for whatever reason, and usually a unequal number is better. So for example, 3, 5, 7. The reason is that you won't have like a half are for and half are against. There's always going to be, like, for example, 3, 2 will be for, 1 will be against, or 2 for and 1's against. So it will always have somebody that is going to have to make a choice on one side or the other to take a decision, and then your decision will be made. So maybe even in those communities to have like ethical community. And so in our case again, if you decide not to treat someone, then you have to start asking a question about palliative care. And palliative care is not really discussed about in many forums that I discuss about, but it is a question. And again, palliative care is not putting a pillow on someone and killing them. It's to try to treat them as best as you can, but letting, accepting that death will be imminent, and with trying to provide to prolong less their life. So, for example, and some people will extubate or will remove them from life supports so that they can have a nicer death, if you know one, but they won't prolong. We won't prolong their life by giving them medication or trying to keep them alive longer than they need to, and so we'll let the process of death kind of take over. Doesn't mean that they will suffer, and actually even more, those people will give even more pain controls and everything for that. And so those would be good discussion to start wondering if you're going to be the medical support about your community, your family, or anybody, to sit down, have a so for example with your family, sit down. What would you, if this happened, what would you do? Would you put somebody in quarantine? What do you want me to do if this happened? Would you like to have this? Because there is no right or wrong question, and this is why it's called ethics. Is because there is no right or wrong questions. It depends on your religion. It depends on your beliefs. It depends on your experience of life. It depends on the situation. It depends on a lot of stuff, and so there's no if this would do that. It's really sitting down, knowing what everybody's like beliefs and everything. So, for example, one big ethical that keeps coming back in the healthcare business is, for example, people for religious belief that do not want a transfusion. Well, it's your right to refuse whatever you want for your belief, because it's your right to believe whatever you want. But, for example, if you bring your child, and your child would survive receiving the blood transfusion, so now the parents are saying, no, you do not give blood to my child because of my religious belief. But then you have the healthcare professionals like, well, as my duty as a healthcare professional, I need to provide the most care about this person. And this person is not in his, so for example, he's 2 or 3 years old, doesn't have enough knowledge or mental capacity or maturity to make that kind of decision, like, do you want a blood test or do you want a blood transfusion or not. And so those will become ethicals, because both sides are right, but which one you're going to choose. And again, there's no right or wrong here. There's no line in between and stuff like this. And so that's where a lot of hospitals, especially children's hospitals, have like ethical boards and everything to take those kind of decisions, because so they'll sit down. So that could be like a good option for you to have over here. And again, I'll put some links down to have some discussion to provide like some supports and or things that you can start thinking about. The other one, like I was saying, is palliative care. And on palliative care, this is the one that you're gonna have to start asking people. For example, what do they want us? What they want you to do if they die or if they're about to die. So, for example, another condition that I can see here. Let's say you have someone that has severe respiratory disease that needs home oxygen. At home, and we'll have a video on chronic disease, but that requires oxygen at home at all the time. Well, if you have a major crisis and there's no supplier of oxygen, what do you do? Do you want to die? Do you want me to let you go? Do you want me to bring you closer to the hospital and actually leave you there? And us will continue to do something. Do you want me to drop you? So I know those sounds a very hard question, and they are hard questions, but there are questions that we cannot ignore because they are actually a reality. If you look at things like Katrina and things like that, those were questions that were asked. Like, for example, if you have someone on a ventilator in a hospital, but has more chance of dying than a new person, than a younger person that comes in, do I remove this person to give the ventilator to the person that has more chance to survive, or do I leave it to this person that is about to die? Who are we to make those decisions? But actually, someone has to make those decisions. So, as a rule of thumb, is always that the grade of many is better than a grade of few. But again, that is a rule of thumb, because, like, again, in the example that we have, so if we have someone that has a lot of knowledge, so for example, if you live in a community, survival community or something, he's your, I don't know, your blacksmith or your engineer that basically runs the whole thing and knows how everything works and everything, that person may require, we may spend a little bit more energy and more resource to try to keep this person, because this person being surviving, or this person getting better, will provide benefits for the survival of the groups. Does that mean that those people should be all safe? Again, and that's why in this video I do not want to say yes or nay, yay or nay, because there is no really answer. It's just mostly questions. It's questions of stuff. It's principles that we need to sit down, and each scenarios, each family, each units of survival that you're gonna form, it's going to need to ask their questions, and serious questions, and sit down and have those things, just like any preparedness that you need to do. That's more mental preparedness. But like, I know some expeditions, for example, if they die, to bring their body somewhere, it is hard to carry. So, for example, if you go in places like Everest, there's actually bodies there. Like, there even some places in books or stories that you read, like after the man with the blue suit, you turn left, and on the green suit you turn right, because people leave them there, because to bring them down would take more resource and put more people at risk of dying than to bring them down. So dead body are left over there. In some expedition, that's one question before you leave for the expedition. They are asked, what do you want us to do with your body? Do you want us to dump you in a crevasse, or you want us to bring you back to have funerals and stuff? And again, it depends on your belief and everything and stuff. And nobody can answer those questions for you. So it is I think it is something that you really need to sit down, discuss. And I wanted to bring that with an example, a concrete example, so that you can sit down. And unfortunately, there's not a lot of resource out there beside like learning about ethics and everything, because everything depends on you. It's you that decides what it's going to be, or the people around, and each person needs to get their things, and even that the scenario may change everything. So for example, another ethical dilemma that you can think, so if somebody's stealing, so you have two people that are stealing, so law-wise they're all breaking the law, but this one is stealing to feed his family, this one is stealing for fun. So ethically, so the law says those two are the same category. Ethically, you probably could make a case that, look, he's been pushed, otherwise he wouldn't do it. So ethically, you maybe have a better reason than this one that is not doing. But some other people would say, no, that the same thing is, stealing is stealing, and there's other ways that you can feed your family and things like that. So there's no right or wrong, and we could sit down here and discuss and have things. But what I wanted to bring more was, like I said, a real discussion about those two topics, and I'll put links again that you can help. But I have serious thoughts about that, and especially for pain. And I see a lot of people like heavy on the bandages and the suture kits and things like that, but not heavy on the pain control. It may be a little bit more important to do pain control than anything else, because without pain, in pain, you won't go very far, and things like that's like burns and things will be very painful. Fracture will be very painful, especially with outside a hospital setting where we can reduce and put stuff in your legs and things like that. So pain will become major actors in this, and we'll do a video. I'll do a video on that subject as well. So anyway, I wanted to give you those questions, and hopefully it was not too dry, but ethics is never really a fun subject to talk about, but I thought it would be very important in where we are right now, because the rest of our care will be affected by that decision, of that trying to always, each decision we're going to make, when we're going to, for example, talk about triage, and this is what's called the start and the jump start, and we'll talk more about those triage. Those tools will be part of taking decision, and always about putting your resource for the best use, meaning that saving the most people that you can. And sometimes it doesn't mean saving number of people, but it means as well as, for example, saving someone that is important and a big support for the rest of the survival of the rest of the people. And so something you have to put your emotions aside and your desire to have one person versus other people. So anyway, I'll let you with your talks. Don't hesitate to send me a message if you need to, and we'll talk to you.